Hi, welcome to the Pre-Surgical Education Program for Hip and Knee Replacement, also known as our PEP Talk. We are so thrilled you have chosen Texas Orthopedics Sports and Rehabilitation Associates, a division of Ortho Lone Star, to perform your procedure. Throughout this program, we will journey from the time that you've decided to have this surgery all the way through the first 3 months and beyond. Let's begin. So this just gives you a little idea of how long everything takes. Right now, you're in the weeks to months before surgery. Then you're typically asked to come in about 2 hours before surgery to prepare. The operation itself can take anywhere between 30 to 90 minutes, and then you're in the OR a little bit longer just because of preparation and cleanup. Your post-op recovery time is typically 2 to 3 hours. Then most patients are going home the same day or spending 1 to 2 nights in the hospital. And that's really just dependent on your insurance, history, a lot goes into that. It's expected that you do go home once you leave the hospital or surgery center with or without home health. And then full recovery, and please be mindful of this, may take up to 1 year. The swelling may not go away completely for up to 1 year. The pain may not completely subside for months. And we're not saying that you're going to have pain every day, but it's just something to keep in mind. Your full function may not happen for up to 1 year. And it can get very discouraging. At that 3-month mark, you may think, I should be back to normal, I should be 100%. And a lot of it really depends on how functional you were, how heavy you were, how healthy you were, not to mention your mental state before and even after. It can all play a lot into your recovery. As you are preparing for surgery, there are 5 steps you need to take in the pre-surgical process. We'll start with preparing your body in your home, to ensuring you have medical clearance. Then you'll have a final pre-op appointment with your surgeon and then a call or visit with the facility that you'll be having surgery with. Let's look a little further into what happens during each of these steps. We will begin with preparing your body with hydration, nutrition, and activity, and ultimately answering the question, how can I be as healthy as possible before surgery? You'll want to make sure you drink enough fluids prior to your surgery to stay nice and hydrated. Try to avoid beverages high in sugar, caffeine, and sodium, and your physician may suggest other guidelines, so please be sure to discuss them prior to surgery. You'll also want to make sure that your protein intake is adequate every day, no less than 2 servings, and it can be found in meat, fish, poultry, eggs, and dairy products. Increasing your fiber intake is vital because some of the medications you'll be receiving can contribute to constipation after surgery. So you should increase your fiber in your diet with a variety of foods like fruits, veggies, whole grain breads, muffins, cereals, and you'll also be taking a stool softener after surgery, but we'll talk more about that later. Please make sure to get adequate calcium too. The recommended dose is 1,500 milligrams with vitamin D. That vitamin D will help absorb the calcium, and that should be at least 1,000 international units. These are found in milk products, fortified cereals, or supplements. Please be sure not to exceed 500 to 600 milligrams of calcium at any one time. Spread it throughout the day. If you haven't already, and you need to, please stop smoking. This includes using all tobacco and nicotine products at least 4 weeks before surgery. Patients who smoke are more prone to infection, so you need to stop at least 4 weeks prior to surgery and a minimum of 2 weeks after. Our physicians may not perform the surgery until you have stopped smoking, so if you need help on resources, let us know. Otherwise, that is what we are requiring. It is recommended that you drink no more than 1 alcoholic drink per day, and none at all for 24 to 48 hours prior to surgery. Please try to decrease alcohol as best possible. If your BMI is over 30, you are considered obese, and with that comes a variety of different potential complications for a total joint replacement. The more you can get your BMI below or close to that number, the better off you'll be in your mobility and overall healing. The evidence suggests that patients that have less weight bearing on those joints tend to do better. And with that, please try to stay active. If you're not already active, do not start up an intense workout program now like CrossFit or marathon running, but we definitely want you to stay active if you're already walking, biking, doing yoga, or things like that. The more you're active now, before surgery, tends to be how well you'll do after surgery. Let's move on to preparing your home through self-preparation and potentially a physical therapy evaluation. Not everyone will receive an in-home physical therapist. It really depends on your surgeon and the insurance company. Either way, you can ensure your home is safe for recovery. The first thing I want you to do is move throw rugs out of the way because you all will be requiring a walker. Let that sit in for a second. With that, you'll want to make sure that anything that may get caught on the walker is out of the way, and this includes the rugs and any other obstacles. You'll want to arrange items in cabinets for easy accessibility. Please don't get up on a step stool or ladder after discharge, and therefore move anything you need to down or up for easy reach, around counter height. Let's teach family and friends to use antibacterial hand gel. We make this joke, but there's some validity here that we want you to treat that new joint like it's a new baby. So no one can touch the baby in the beginning, and if they're going to come near you, make sure that they're using proper hand hygiene. And of course, during COVID times, try to eliminate or decrease overall exposure. We want to take steps to ensure that your pet does not jump up on you while walking. You may need to consider boarding your pet if you have a feisty little fella that may not only get near your incision for cleanliness, but may also be a fall risk factor. And with that, we do advise that you avoid letting your pet sleep in your bed until your surgical site is completely healed, and this means no scabs or skin breakage. And as mentioned before, a home health agency may also come out and evaluate your home for safety. And again, that determination will be made by the surgeon and insurance company. Since this is considered a major operation, we want to ensure you are going to have a successful outcome. To do that, we send you for what's called medical clearance. And depending on where you're having surgery is where you'll go to have this clearance. For example, anyone having surgery at a Seton facility will go to Seton Pasco, St. David's facilities will go to Internal Med Solutions, and Cedar Park will go to Cedar Park. No matter where you go, you'll receive a similar experience. So what happens at this appointment? Typically, they'll do lab work, and you may or may not receive an EKG or chest x-ray. It really depends on your history. You'll want to be sure to let them know of all medications you take, including over-the-counter supplements and vitamins, and they may taper or stop current meds to prepare for the surgery. You may be tested for MRSA and MSSA. These are done to ensure we are giving you the right antibiotics before surgery to prevent infection. And they may also reach out to your other doctors, depending on your history, to make sure they have all the information needed to mark you safe to have this procedure. And pain management doctors, if you have one, should be visited before surgery so they can prescribe pain meds for after surgery. So what do we mean by optimization? Let's touch up on this real quick. If you think about it, if we asked an individual to run a marathon tomorrow without any sort of preparation, we would almost certainly be disappointed by the results, as their body would not be able to handle such a significant stress because it wasn't ready. What we're trying to do is reduce any potential complications and improve the overall safety of this procedure being performed. There are things that we can't modify, such as age, as much as we would love to, your race, your surgical history, chronic disease. At this time, we can't do anything about it. However, there are things that we can modify, and by modifying or improving them can give us better chance for success. We can stop smoking, we can get our weight under control, look at our diet, see if there's anywhere we can make any improvements. We'll take a look at your hemoglobin A1C and maybe your diabetes medications need to be changed, or maybe your diet needs to change. If you have iron deficiency, anemia in your blood, we can give you iron to replace that. And then pain medication use. This procedure that we'll talk about in a little bit will create a bit of discomfort. And we'll want to make sure that once you're taking the narcotics that you are safe in doing so. So if you've already been taking a large number of narcotics prior to surgery, it's going to be a lot harder to get you managed after surgery. About a week before surgery, you'll have your pre-op appointment with your surgeon. During this appointment, any questions you may have will be answered. The surgeon will review any clearances and any other results they may have. You should get your prescriptions at this appointment, so please be sure to have them filled before surgery. And you'll also make any post-op appointments if not already done so. You won't be wanting to deal with that right after surgery. And finally, the facility in which you will be having your procedure will reach out to you and will want to make sure that you have all the information you need for the day of your procedure and they have all the information they need. Maybe a call, it may be a visit, it really just depends on the facility. They'll inform you as to where to go the morning of your surgery, as well as letting you know of any visiting policies. With COVID, things are always changing. They'll finalize your arrival time and when to stop eating or drinking. They will also review any medications to stop or continue before surgery, and they may consult with anesthesia depending on your history, or the anesthesia personnel may reach out to you. And of course, they'll clean up or finish up any necessary paperwork or computer work that's needed from you prior to surgery. Let's talk about some of the do's and don'ts for the day of surgery. Again, you'll need a 2-wheeled walker, not one with 4 wheels, not one with a chair, 2 wheels. And the reason for that is because that's what's safest for you after a total joint replacement. One will either be delivered for you, or you may bring one that's been fitted for you in. Do not borrow one from someone that is over a foot height difference from you, because it may not work properly. You'll also want to remove all piercings, nail polish, and artificial nails, specifically on that operative leg. We do require that you shower with a soap called Hibiclens 5 days before and the morning of, for a total of 6 showers. We will talk more about that on the next slide. Bring your glasses in a case if you need them, specifically for reading, because you will be signing some pretty important papers that morning, but no contacts. Wear loose, comfy clothes. A t-shirt and shorts are typically best, nothing too tight, no jeans, and a good support shoe. So something with a rubber-soled bottom and closed toes. No Crocs, no flip-flops, anything like that. And you do want to bring your insurance card and ID, and any payment owed. Even if you've given these things to the facility many times before, still bring them. We don't want you to shave that affected leg at least 48 hours beforehand, and just a reminder, no alcohol 24 to 48 hours before. Don't use any lotions, perfumes, or deodorants the day of. And don't bring your actual medications. A list of meds is fine, but please don't bring any unless you are instructed to do so. And don't bring any jewelry or cash, as you won't need it. And we cannot stress this enough, that we don't want to cancel your surgery, but we will. If you have any cuts, scrapes, or bug bites on that affected leg, specifically around where your incision will be made. This can be a huge potential source for an infection, and that's the last thing you'll want to be dealing with after your surgery. So let's talk a little more about this Hibiclens soap. You may receive it at your medical clearance appointment, or you can purchase it at any pharmacy, such as CVS, Walgreens, HEB. Most pharmacies will have it, and the 8-ounce bottle is fine. The idea here is that you're going to use your regular soap, regular shampoo on your body, your head, your neck, your genital area, and then once you're done, you'll rinse off, and then apply the Hibiclens with a new washcloth directly on your skin, staying away from the shower stream so the soap can absorb. After a few minutes, you'll rinse off again. Please be sure not to use this soap on your head or genital area, and don't use your regular soap after using the Hibiclens. And be sure not to use any lotions, deodorants, powders, or perfumes the morning of your procedure. The days before are fine, but not the morning of. And there are instructions in the box online, but in a nutshell, that's what it looks like. We've had to take special considerations due to the coronavirus or COVID-19. Joint replacements are still required to have COVID-19 testing at most facilities. If you've had the vaccine or plan on getting the vaccine, you may not be required, but please be sure to ask. Each facility handles it a little differently. For example, if you go through the Seton facility, Seton Pass Go, they'll coordinate your test. If you go to a hospital, they'll most likely do the test the morning of surgery, or you may need to go to ARC. The requirement, if you have your test before your surgery, is that you do quarantine. And that can be tricky because we're asking that you not go anywhere or see anyone after your test, so please plan for that. Each facility also has their own visiting policy. Many are not allowing their visitors in at this time, so be prepared and plan accordingly. Sometimes your ride home won't be able to come in until towards the end. So that's a good 6 or 7 hours time span from when you're coming in for surgery to the time that you're leaving. And it's important that you inform your surgeon or the facility ASAP if you or anyone in your household tests positive for COVID-19 and or develops any symptoms. Also, please be sure to report any travel within 14 days of your scheduled procedure, whether that be another state or another country. And please wear a mask to the facility, and they'll most likely give you a new one prior to your surgery. That completes the preparing for surgery phase. As you can see, there's a lot to be done to prepare for this surgery, and the more you can do, the better off you'll be in the success of your procedure. Let's move on to the pre-op phase. We'll review what's going to happen from the time you arrive to the facility to the time you enter the OR. Most likely, one of the first things to happen will be a temperature check, and any final paperwork will be completed with registration. You'll change into a surgical gown and personal belongings will be stowed away. CHG or chlorhexidine gluconate wipes will be applied at this time to cleanse the skin, and hair that needs to be removed will be clipped. The nurse will review your history and medications as well as explain what's about to happen. The nurse will then insert an IV and give medicine to help with pain management. This is usually a combination of Celebrex, Tylenol, Lyrica, and maybe a narcotic. Then anesthesia will come by to talk about options. We'll talk more about that on the next slide, as this really depends on your history and the type of surgery you're having. You may receive a nerve block at this time as well. They will give you some nice friendly medications if needed to make you not remember if that's what needs to happen. And then the surgeon will come by for any last-minute discussion, sign the consent, and mark that operative leg. Finally, the surgery team will come by and roll you into the operating room. We're now moving on to the operation itself, but don't worry, we won't get into all the gory details. You can Google those later if you want. Patients often ask, what kind of anesthesia will I be getting for this? The most preferred and recommended method these days for joint replacement is regional anesthesia. It's a single injection in the lower back and it happens right there in the OR. It'll numb you from that point down to your toes for several hours, and then they'll give you a combination of another medication to make you sleep, so you won't hear or remember anything, and it results in a very quick recovery. You're up and walking within an hour or two after surgery and don't have those same side effects as general. The numbing does go away. Some folks get a little hesitant about it, but it's done very commonly now. General is not done as often, and we really only do it nowadays if we're not able to do regional anesthesia for some reason, such as if you have an extensive back history or something like that. And then with the blocks, it really depends on the surgeon, but they are primarily done for knees. It can be done through a nerve catheter, as we've talked about before. This is inserted before surgery and attached to a pump that will stay in for a few days and then very easily removed at home. And it's delivering a continuous numbing medication to the front, side, or back of the knee. And or we can give you something called a periarticular cocktail injection. And we use the word cocktail because it's a combination of a few different medications. And that will happen right in the OR during surgery to help numb it for 24 to 72 hours. So it really just depends on your surgeon and your history. You may or may not be one of those individuals that likes to look up everything prior to a procedure, but either way, we'd like to give you a high-level picture of what the joint replacement will look like. We'll begin with the hip replacement. These are usually made from cobalt, chromium, and or titanium metals, and then the stem, that long piece, is either cemented in or not. It really just depends on your surgeon and how bad your hip was to begin with. The procedure is typically the same, where they're shaving out the arthritis and putting these implants in, but the approach, including the incision area, might be different. It can be done either anteriorly, which means the front of your leg, laterally, which is on the side of your leg, or posteriorly, which is in the back of the leg or near your buttock area. Depending on your approach, you may have to follow what are called hip precautions. This would include no bending at your hips past 90 degrees, no crossing your legs, and no internally rotating your toes. Your surgeon will let you know if you need to follow these precautions, and if you do, they'll need to be followed for the first month or two after your surgery. And in the majority of cases, you'll be able to bear full weight on your hip replacement. If there's any restrictions, you'll be taught how much to put on that leg. And we also want to stress that every effort is made to restore your leg back to equal lengths to the opposite side. Some patients notice it, some don't. They will also do x-rays in the OR to check for it, but every effort is made. And it really just depends on how much arthritis was there, how much the surgeon had to remove, and whether or not you're considering your other side, because that can definitely factor into it as well. Let's move on to a knee replacement. You'll notice that we don't cut off your knees and put new ones on. It's really just a removal of the arthritis and then covering the bone with these components. A lot of it's made from titanium, cobalt chromium, or a mix. Really just depends on what your surgeon's preferences are. But either way, they're just shaving down the arthritis, putting a piece on your lower leg, shaving away, putting a piece on the upper leg, and then shaving away the arthritis on your kneecap and putting a little button on it. So that will be your kneecap still after the surgery. Your surgeon can tell you what kind of implant you'll have. Okay, so your surgery is all done. Now the real fun begins. So what will get you discharged from the surgery center and/or hospital? Typically, you've walked about 150 feet with a walker. You've negotiated stairs if you have stairs to negotiate at home. Your pain is managed, and we'll talk more about that in a minute, but managed. You've peed or successfully urinated as written there. And then that you have a co-pilot or caregiver or support person or whatever word you want to use available for transportation and assistance at home. Let's talk about that for a little bit. We're not asking that they come into your home and wait on you hand and foot and that they assist you in wiping yourself after using the bathroom or anything like that. But you will need someone to ensure that you have meals. And then for sure in those first few days, at least the first 3, that's when you're most at high risk for falling. The reason for that is because you've had anesthesia, you're on narcotics, you're trying to learn how to walk again. So it's really highly suggested that you have someone there just to kind of brace you or be there as a guide so you're not alone and they can help you, if you're going up the stairs or if you start to feel dizzy. It can also be a little difficult to pick up that leg right after surgery, so it's just nice to have that extra set of hands. So yes, it's very important that you have someone that's willing and able to assist you once you get home. Let's talk about pain. Inevitably, you will experience some level of discomfort after this procedure. Everyone will experience it differently, and that's why we use a standardized scale. Because although it's different, it's typically described similarly. Ranges anywhere from a 0, meaning pain-free, to a 10, which is just unimaginable, unspeakable pain. That's typically where we've seen folks who are passing kidney stones, women in labor, and if a joint patient doesn't get their pain under control, it could end up there as well. What we'd really like to do in your immediate post-op time or immediate recovery is keep you within this 3 to 5 range. This is the area in which we say it is tolerable, you can still move around, but it will be a little uncomfortable. A 0 right after surgery may be unrealistic for some, and of course any more severe than a 5 or 6 may prohibit you from actually moving around. So when should you expect to feel this discomfort? The day of your procedure, you may not have a lot of pain, even the day after. That's typically because of the anesthesia, you just got this block in, you're taking the narcotics. It's usually suggested that you take them preemptively for the first few days to stay ahead of it, so you don't fully appreciate the pain at that time and you're not walking a mile yet. It typically picks up in the first few days, 3 to 5, maybe even up to a week. Gets the most intense during that time because you've pushed your mobility a little bit more, you've tried to taper down the narcotics, it's all kind of just catching up on you. The pain block is out at this time. There's just a lot of factors that go into this peak time. It's usually when the discomfort is experienced the most, and we're not telling you this to scare you, it's just to prepare you for this normal experience and to be mindful of how much you are pushing yourself during this time. Between a week and 1 month is going to be a roller coaster. There's going to be good days, there's going to be bad days. You may wonder, why was I having such a good day yesterday and now today I'm having a bad day? Really, a number of things can go into that. Your body's healing, trying to get back to normal. A lot of folks end up overdoing it one day and then they will feel it the next day. And then between that 3 to 12 month mark is when you're getting quote unquote back to normal. At this point, you no longer need the narcotics, you're functioning without an assistive device. The pain that most people experience at this time is just because they've literally tried to run a marathon or did 10 rounds of golf or something like that. And you might need an Advil or something at this time, but most patients are feeling again, quote unquote, normal. So how can we manage this pain? Again, we want to get you to a manageable level. 0 is not realistic, definitely not within the first few days till about a week after surgery, so we're going to use all of these to get to that manageable 3 to 5 level. Ideally, you should be able to move around without having all the side effects of narcotics. Let's begin with that orange area before surgery. Again, if you need to lose weight because you are falling in the obese category, please try to do that. The less weight that you have bearing on these joints after surgery, the less pain you should have. And if you're able to, you can tolerate it, your doctor says it's okay, try to exercise and specifically try to strengthen those muscles around the joint to support it for after surgery. The stronger your muscles are around that joint, the less it'll have to do. And then if you're able, please try to decrease or eliminate any narcotic use before surgery. The less you're using beforehand, the better off we'll be in managing it. So ideally, the more that you can do all of these things, the less other things in that circle that you'll need. Again, before surgery, we'll give you a combination of medications such as Celebrex, Lyrica, Tylenol, maybe a narcotic, a block if applicable. And again, these are all to help decrease any narcotic use after surgery. During the surgery, we may give you that periarticular injection we talked about. And again, this is to also help decrease narcotic use after surgery. Then after, we'll give you things such as Celebrex or meloxicam. These are anti-inflammatory medications to help with swelling and pain. Tylenol. You may get tramadol, which is a non-narcotic opioid, so it's a little nicer on your system. And then the narcotics such as oxycodone and hydrocodone. We want to be clear that we're not saying that you shouldn't take any narcotics, but we do want to try to decrease the amount that you are taking because they can create some issues such as constipation, dizziness. You can get tolerant to them, which then may make you want to take more. So ideally, we're just trying to decrease and then eventually eliminate them altogether, while still making it manageable for you to participate in activity. The power of distraction is real. TV, books, make a phone call to people you haven't talked to in a long time. If you think about it, if you're doing nothing, your focus will be on that new joint and what it's feeling like at that time. We are very big proponents of cryotherapy or ice. You can use things such as frozen bags of peas, a homemade ice bag with 5 cups of water and a cup of rubbing alcohol, and a gallon Ziploc bag. You can also purchase one of those ice machines. Whatever you need to do to get ice on that joint after surgery will help decrease that swelling and inflammation. And did you know that mobility is medicine? It can help restore strength and mobility of the joint, reduce complications like blood clots, and reduce stiffness and pain. One word of caution though, is that some patients can get very excited because their pain and mobility are better after surgery than before, but then they end up overdoing it to speed up the recovery. This is not recommended because then you typically end up having increased pain and an increased risk for falling. It's a balancing act. So what are we going to do? We'll stay active before surgery as much as possible. You'll walk for the first time in the recovery room with a nurse and a walker. Then ideally, we'd like you to get up and move around every 45 to 60 minutes. And we're not saying to take a purposeful walk. Just change your position from lying to sitting, sitting to standing, maybe just marching in place. Just move around that joint a little bit. You may be visited by a physical therapist and occupational therapist soon after surgery. They'll work with you to create a plan to help you get stronger and independent in caring for yourself. And if you need continued therapy, your surgeon will send you to an outpatient center. Again, a 2-wheeled walker is required because of the anesthesia, pain medication, overall weaker muscles. This will all increase your risk of falling. So again, we're just throwing it out there that you're going to either bring it with you or one will be delivered for you. No other equipment is typically needed for this surgery. That's all dependent on your home situation and any recommendations made by your surgeon or physical therapist. And some patients may progress to a cane, or they'll go from the walker to nothing between that 10 to 14 days. It's really all going to be dependent on how safe you feel in walking, and if you do move to a cane, it will be vitally important not to create a limp when you're walking with it. Now let's talk about what happens once you get home. In addition to managing pain and getting up and moving, we'll also want to focus on preventing complications, such as constipation, falls, blood clots, infections, and implant issues. Let's talk about each of these in depth. Constipation seems to be one of the biggest potential complications. Typically, it's caused by pain medicine, dehydration, inactivity, and anesthesia. And if it's left untreated, it can lead to a bowel obstruction. So let's talk about what you're going to do. First, we'll want you to take a stool softener called docosate sodium or cholase twice a day, specifically while you're on that pain medicine. In addition to that, we'll want you to take Miralax or 2 tablets of Senokot daily. These will kind of help things get moving. And then if you don't have a bowel movement for 3 days, we'll want you to take something called magnesium citrate, 10 ounces, drinking half at a time with 16 ounces of water. This is what they typically use to prepare patients for a colonoscopy, so be prepared for an immediate evacuation. However, if you still don't have a bowel movement after that, we'll want you to notify the physician, and we'll go over how to contact them in a little bit. And it's not unusual for patients not to have a bowel movement for a few days after surgery. Passing gas is typically a sign that things are moving in the right direction. So for some of us that are used to having a bowel movement every day, it can be a little scary, but as long as you're passing gas, you know things are moving along. Preventing falls is very important after the surgery because you don't want to do anything to potentially harm your new joint. It's usually caused by learning to walk with a new joint, pain medicine and other medications that you might be taking, dehydration and anesthesia. So what you can do is first, sit on the side of the bed or chair for a minute before standing up, especially in those first few days. This will help minimize dizziness or lightheadedness. You don't want to just pop up and run to the bathroom. Be mindful of any tubes that can keep you from moving safely. Some of our knees, for example, will go home with a nerve block that's delivering medication, so make sure that it's attached to you when you're getting up to move. And again, have someone assist you to the bathroom for the first few days after surgery to ensure that you're safe. And practice moving in your home environment prior to surgery while observing your surgical precautions. Pretend to walk around with a walker in your home before surgery to kind of see what it's going to be like afterwards. Although the incidence of blood clots in your legs and lungs is very low, it's still something you have to be mindful of once you have this surgery. They're typically caused by not moving around a lot, the recent surgery, and your medical history, and you are at increased risk if you're obese and or smoke. So what you can do, of course, is stop smoking at least 4 weeks before, and lose weight if needed as soon as humanly possible. Keep moving after surgery, and you really want to avoid any long travel initially. If you plan on traveling, be sure to have that discussion with your surgeon if it's a good idea or not. You'll want to take your anticoagulant medication. For example, most of you will be on aspirin twice a day for 4 to 6 weeks. And you're going to wear your compression stockings. These are typically either knee-high or thigh-high stockings, and they'll be worn most hours of the day, minus when you're showering. And this will help decrease swelling and also just allow for the blood to be pumped back up to your heart. And of course, you'll want to report any signs of a blood clot to your surgeon, which can include pain in your calf and leg unrelated to your incision, and any unusual swelling of your thigh, calf, ankle, or foot. And it can get very confusing, the swelling that you have and questioning whether or not it's a blood clot. Again, this is unusual swelling. This is all of a sudden out of nowhere. We do encourage you to inform your surgeon if you think this might be the case. And those of you that have those little squeezers or SCDs or sequential compression devices, we'll wear them for a few days when you're not moving around, so that can also help pump the blood back up to your heart. And please, do not pass go, do not collect $200, just call 911 or go to the ER If at any time you're having significant chest pain, which gets worse with breathing, and or sudden shortness of breath. This can be indicative of a blood clot that has traveled to your lungs, and that is something that will need to be taken care of immediately. A surgical site infection is also something that does not commonly happen, but there's still a potential for it. It's caused by germs entering the surgical site during or after surgery, and you're at an increased risk if you're obese, have uncontrolled diabetes, and or if you smoke. As you see, we talk about these things a lot, and it's because they really have an impact on the success of this surgery. So what you can do is stop smoking 4 weeks prior and 2 weeks after, get control of your diabetes, and lose weight if needed. Make sure you don't have any unresolved teeth issues. It would be ideal if you could get a teeth cleaning prior to surgery, because we won't be recommending one for up to 1 year after surgery. And that's because with any dental work comes the risk of them loosening any bacteria in your mouth, which then can travel to your new joint. We'll want to make sure that you shower with that Hibiclens soap 5 days before and the day of surgery. And be sure to report any cuts, bug bites, or scrapes on the affected leg. Hand washing, hand washing, hand washing. It's the most important thing you can do. Most times when patients get an infection after surgery that's caused by the patient, it's because they had ineffective hand washing after the bathroom. Again, don't shave that leg for 48 hours beforehand, and keep that dressing area clean. Don't pick on it or pull on it. It's enticing to want to play with that area after surgery, but you'll want to keep your hands away from it as much as possible. And you'll want to be mindful of and looking for things such as redness, pus, delayed healing, meaning it doesn't look like it's healing, a fever, so anything above 101, tenderness that's new with warmth, swelling. You'll usually see a combination of these things, and it does take a minute for the infection to brew. So if it's just a few days after surgery, it's unlikely that it's an infection. But of course, if you have any of these things and you're concerned, you'll want to report it to your surgeon right away. And finally, let's talk about ways to prevent issues with that implant. A lot of times it's from wear and tear, breakage, a possible dislocation, an infection, or just loosening of that joint. So after surgery, it'll be important to aim for lower impact activities such as cycling, elliptical, and walking versus those higher impact ones such as running and jumping. They can put a lot of pressure and strain on that joint. Of course, you'll want to prevent an infection and report any signs and symptoms of one. Try to prevent falls, as we've talked about, and if you were instructed to do so, make sure to follow those precautions, and report any signs of instability. For example, if you feel your knee is giving away. And if something does happen with that implant, it may lead to a revision surgery. Most implants are lasting 20 plus years, so if you have that surgery done at a young age, there is a potential for revision surgery in the distant future. Let's talk about caring for that incision. For the first few days to weeks, it will be closed with sutures, staples, or glue. It just depends on your surgeon, and there will most likely be a waterproof dressing such as Aquacel, Mepilex, or mesh over it. You can cover it with a plastic bag and tape with showers to protect it, and some minor drainage is expected. However, if more than 50% of that dressing is saturated, it will warrant a phone call to either the home health agency for using one or the surgeon's office. You'll want to keep that dressing clean and dry. The dressing will either be removed at the first follow-up appointment or by the home health agency, and if you have staples, they'll be removed around that first follow-up appointment as well. You don't want to submerge it in any pools, hot tubs, baths, etc. until that incision is completely healed, meaning no scabs or openings at all, and you don't want to put any lotions or ointment on it until it is completely healed. Around that 4 to 6 week mark is when the incision should be fully closed. You may notice some sutures start to pop out within that first month, and that is completely normal. Let them do their thing. However, if they're prohibiting your incision from being able to close, please let your surgeon know. And you may start putting some vitamin E and scar cream on it once that incision is completely closed to reduce the look of the scar. Some people care, some people don't, to each their own. But in any case, you do want to be sure to get clearance from your surgeon before submerging it or putting anything on it to make sure that it is completely healed. You'll notice here at the top, these are 2 pictures of a patient with a Aquacel bandage. The one on the left is completely fine, normal, we wouldn't do anything with it, but the one on the right would warrant a change, mostly because the drainage has touched the edges and therefore can ruin the integrity of the dressing. The middle left picture is an incision with staple closure, and the middle right picture is one with the mesh dressing. And then the bottom picture is a completely healed scar. Let's talk a little bit about what the leg will look and feel like after surgery. We do expect the entire leg, or just sections of it, to be swollen for up to 1 year, but it should improve with ice and elevation. And by elevation, we mean your toes above your nose. As you can see depicted in the picture, that leg is up, and it's a great way for a knee patient specifically to get their leg elevated without putting too much bend in their knee. Knee patients will want to try to avoid long-term bending of that knee while they're resting because of the need to get it completely straight after surgery. Hips, you have a little more leeway on how much the knee is bent as you elevate your leg. Bruising is also expected from thigh to mid-calf and usually peaks in about 1 week. So if you've had none and all of a sudden you're looking like the purple people eater, it's completely normal. And then that should also resolve within a few weeks. Mild drainage at the incision is normal. Peak drainage should be in about 3 days after surgery. That's when you're usually getting up and moving more. And numbness is very normal, especially at the incision site. And when you have the surgery at the front of your hip, having numbness on the side of your hip is normal, and that can last quite a while, up to 1 year, but it should resolve. And then a low-grade fever, because our body's in this high-gear anti-inflammatory response, so having a little bit of a low-grade fever, especially in the first week, is very normal. The real question is, when should you be concerned? Well, if you have swelling that doesn't seem to be going down at all with ice and elevation, your dressing is saturated, especially over that 50% mark, you do develop a fever of over 101 degrees Fahrenheit, and that's after taking off all of your blankets, or if you do start to develop symptoms of a blood clot or an infection. Ideally, you would start off with a home health agency if you're using one, then moving on to the Texas Orthopedic Nurse Line. And they do have after hours if it's between the hours of 5 p.m. and 8 a.m. And then as a last resort, if you cannot get in touch with any of the above, we will want you to go to an urgent care and then if needed an ER, depending on your symptoms. Recovering from a total joint replacement takes months and again up to a year. It really depends on your history, your age, your debility beforehand. There may be times when you're wondering, why did I get this done? But we promise you that by this point, you'll start to see the benefits in living your new life with your new joint. These are some frequently asked questions from joint replacements that usually come up within the first few weeks after surgery. The first is, how long until I can drive after a hip or knee surgery? Well, a patient must be able to control their leg. And what we mean by that is you must be able to very quickly and firmly press on that brake. It is ideal to take a little test drive out in a parking lot prior to your venture out into the real world, and to pretend that someone that you really love is right in front of that car. Can you safely brake it? And you should also not be under the influence of any narcotics. On average, patients can drive anywhere between 2 to 4 weeks following surgery. Older patients may take a little longer. Next is, how long before I can return to work? Well, it really depends on your job requirements. In general, patients can plan on being off work for 4 to 6 weeks, closer to 2 if they have more of a sedentary work lifestyle. And again, if you can, try to take a test drive of your day of work prior to going back to work to see if you can really handle it. And finally, will I set off metal detectors? In short, yes. Give yourself extra time at the airport. It really doesn't matter if you have a card or something to prove that you have a joint. You're still going to need to use the body scanner line if possible. And finally, we will leave you with some important contact numbers for home health, the orthopedic triage line, and the medical clearance folks. Again, we are so appreciative that you have chosen Texas Orthopedic Sports and Rehabilitation Associates, a division of Ortho Lone Star, to perform your total joint replacement. Please let us know what questions you have. Thank you.